Says it's time. It's 5 o'clock.
You guys ready? The meeting of the Board of Ellis County Commissioners will now come to order. Let's stand for the Pledge of Allegiance. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Donna, if you'd like to call the roll.
Commissioner Dean Hazelhorst.
Present.
Commission Chair Butch Schleier.
Present.
Commissioner Dustin Wood.
Present.
You have a quorum present.
Okay, thank you. Order of business. We do have an executive session.
Correct.
Okay. Prior minutes. Did you read the minutes from the 13th and 17th?
Yeah,
No problems?
no problem.
Okay. The meetings will stand as presented. I'll need a motion for the consent agenda.
I'll make a motion to approve the consent agenda items A through G.
I second that.
We have a motion and a second. All in favor say aye.
Aye.
Motion carries 3-0. Are there any issues from persons not on the order of business? Okay. The monthly financial report. Fellow commissioners, do you have any comments, concerns?
I had none.
None.
Okay. First agenda item is the COVID-19 update. Jason?
Good evening, Commissioners. Jason Kennedy, Ellis County Health Services Director. So I'd planned on bringing up the charts, but I honestly didn't give IT enough heads up, so I'll make sure and email you guys the charts, but we'll go through what we're looking at. So as of right now, as of today, we have 198 active cases in Ellis County. We have 650 total cases. That gives us a 7-day percent of positive of 13%, which is a significant decrease from what it was about a week ago on the 27th of about 22%. We've conducted 5,000 total tests at this point, and honestly, 2,100 of those have been in the last 2 weeks, thanks to, honestly, the amazing medical community here. We saw the percent of positive significantly higher. I think we talked, I'm not sure if we talked here, but at the City Commission about our level of percent of positive was outside the 20% mark, and it really was just indicative of not enough testing. So the medical community has done a phenomenal job of bringing that down. We do still stand at 1 death. If we look at our cases specifically, 54% of our total cases come in the population 18 to 24. I think we kind of all have known that for a while. 63% of our active cases are in that population. If we look at our totals by city, and honestly, this graph is kind of a wasted graph anyways because it tells us what we already know. The majority of them are here in Hayes. 92% are here in Hayes. However, the reason I put it together was because the cities of Ellis, Victoria, and Shinshin have been impacted as well. 4% of our cases come from the city of Ellis, 3% out of the city of Victoria, and 1% out of the city of Shinshin. So it's this virus has been widespread. It's been felt by most everybody in one shape or another. If we look at our 7-day average case growth, we actually have seen some improvement over the last few days. I know this weekend's report kind of freaked everybody out, but a lot of those cases were actually from time period prior to reporting. KDHE has been, because of the onslaught of cases, some of their data has been coming out late. So we get notified of cases that are a couple of days old. So those cases did get credited back. 7-day average percent of positive obviously has significantly declined in the last week. Like we talked, from around 22% to down about 13-14% right now. The 7-day percent of positive, I can't speak highly enough of the medical community. That truly is just a testament to the amount of work, the amount of time that's put into not only collecting the samples, but ensuring that the correct paperwork's filed, that they get to where they need to go to. And there's a significant cost associated with that to those facilities. So all of the medical facilities in Ellis County have done a phenomenal job. They all still have plenty of capacity to test. We still have plenty of test kits available. Anyone that's symptomatic, nobody's been turned away because because we didn't have test kits. So we do still have those. We also have requested, we have a continuous request from emergency management at the state level to make sure that we have or ensure a decent stock of those here. We are unfortunately currently working with 2 facilities to monitor outbreaks in communal housing. Those outbreaks actually account for 59 total cases over the last 4 or 5 days. Obviously, that is driving the significant bump that we had this weekend. We've had 1 school that actually has closed down. We worked with them over the weekend. They closed not because of a massive outbreak, like I'm sure everyone assumed, but they closed because they have so many staff that are in quarantine or this and that it just wasn't feasible for them to provide a safe environment for the kids with staffing and everything else to bring them all back. So they are going to close for a short duration. It really gives us time to, and we kind of started this with the schools anyways, if we determine a positive in a classroom, we generally shut the classroom down for 48 hours. That gives us time to contact trace, gives us time to clean, gives us time to ensure that we're bringing everybody back into a safe environment and we get notifications out there. This one just lasts a little longer because there's just more to it. So it does give them time to do that, time for us to do the contact tracing, them to clean, and make sure that they have adequate staff to return to the building. Several businesses have closed off and on over the last couple of weeks since the last time we talked. None of those businesses were closed at our request. They were closed because same situation, they didn't have staffing, they didn't have enough people to open their doors and maintain openings. So we encourage really any business owner to take that decision on their own. If they feel like their business has been significantly impacted or if they feel like they can't open, that's up to them to determine what happens. We will contact trace through their staff. We'll pull the people that we feel are contacts and maintain. We will ask them, or they will be mandated to quarantine. But we have not closed any private businesses. Unfortunately, this is what the new normal looks like. We need everybody to work together to ensure that we can keep schools and businesses open. That is our goal. Our goal is to take these measures to contact trace, to quarantine, to isolate, so that we can continue to move forward with what needs to happen. If people wash their hands, they don't gather in groups, and they wear masks, if they can't avoid contact with others, we can slow some of the case growth. If people will strictly maintain isolation and quarantine, it will help significantly. A vast majority of cases of all viral transmission happen in the home. Spread it in areas where you have close, intimate contact. You can't socially distance inside your home well. If you are positive, isolate. If you're mandated to quarantine, isolate. If we can cut in-home or familial contacts out, if we can cut that amount of transmission out by taking good measures inside the home, wearing a mask when you're inside the home, washing your hands inside the home, wearing a mask, washing your hands, and avoiding contact when you're behind the counter, when there's nobody in your business, that is when COVID spreads. It's not likely that you'll catch it from a passing contact, what they call intermittent contact, walking by somebody in Dillon's. It is not likely, sorry, I try not to name businesses, whatever, you know what I'm saying. It's not likely that you will contract a virus strictly passing by somebody. You will contract it if you're sitting at the break table behind closed doors where you're taking absolutely no measures to protect yourself. We can't protect the population 8 to 5 if the population won't protect itself from 5 to 8. COVID doesn't take weekends. Staff of the health department doesn't take weekends. Protect yourself on the weekends, protect yourself outside of work, and we won't have to do any further draconian or mitigation measures the rest of the time. If you're symptomatic, call your primary care physician, work with them to be tested. Does have any questions for me?
I have a question for you, Jason. It's a question and it's a concern too. I know from personal experience that surveillance takes a lot of effort and a lot of time. How are you and your staff holding up and doing all this?
I got to tell you what, I've got a phenomenal staff. They are working round the clock, weekends. They are doing everything that they possibly can, but it's taking a toll on them. I see it in their faces every morning when I walk in. I understand what it takes out of them. I know our staff is all part of the community, so they get calls on their personal phones. They get calls. There seems to be no respect of boundaries when we deal with COVID. So it's which is okay. People are scared. They're they want the information. They want to make the right choice. But I'll be honest, my staff is tired. They're wore out. They're beat up. But so is everybody else in this world. We're all tired of COVID. We all just beg for it to go away. Sometimes we don't even want to get out of bed in the morning because we don't want the day to start because we know COVID's there. That's not going away. So staff is tired, they're beat up. We're trying to bring on more staff. We have applied for a grant to actually bring on possibly some full-time positions. We're looking at some options to try and bring on more staffing, but right now it's when you're underwater, it's not a great time to learn how to swim. So we have some training issues, things like that we'll have to deal with when we get more staff on board.
Is there any concern for losing staff because of this issue?
Yeah, it's that's like my first question every morning. You're not going to quit, are you? So far, they haven't said yes, but their face says otherwise. They cannot keep a pace like this. They can't continue to do this. And honestly, the community, we cannot continue down the same road and expect different results. And that's what I'm doing with my staff every day, which is why we've got to make some internal changes and we've got to bring on some more staff to try and support the effort.
Well, just my observation, a couple of observations, but surveillance isn't mitigating the situation, especially when it's this community spread. All we're really doing with the amount of testing we're doing is just counting numbers. I heard a news report last night that this country is spending $1 billion a week on testing. Now, I don't know that there's really a means to an end here. We're just testing. We're getting more numbers. The more numbers you get, the more people panic. And it creates, a lot of times for the right people, it just gives them more power or profit, whichever one you want to choose.
Sure.
And but we're not going to mitigate this through surveillance. We'll just count numbers. But while we're doing this, it's going to cost the county a lot of dollars. It's going to cost the state dollars. It's going to cost the federal government dollars. So we can have statistics for this. I think another observation I can make is these masks do little or no good. People can wear them. They may choose, or they may believe they're safe with them, but essentially they're not. So we're implementing a couple of measures. We're not going to slow this spread down very much. May curtail it a little bit, but it's not going away. It'll just still be out there waiting. And until we can get a safe, valid vaccine, this issue is just going to be with us, and it's going to continue to grow. And I guess all I can really encourage people to do is choose where you go and what you do.
It's really the biggest step, and I will speak to a couple of points you made. Asymptomatic testing is difficult. The CDC took a bit of a beating because they didn't really change anything, actually. They've been saying that the whole time. If you're not symptomatic, you don't really need to be tested. That's what we've been doing in Ellis County from the start. What you've seen lately is we've had to do a bunch of asymptomatic testing with long-term care facilities following KDHE guidance because of outbreaks, things like that. We have been testing way more asymptomatic people. The problem, and what people don't understand with asymptomatic testing, is it doesn't tell you anything about the person's status right now. You cannot be contagious any longer. You can be past your infection. You can be over it and still test positive, really up to 90 days. It's usually closer to 30 to 60 days. So that's why asymptomatic testing is not recommended, because it doesn't show active or inactive virus. It strictly shows presence of viral material. And so there is a lot to be said for some of these efforts are at the state level are about gathering numbers, but I will tell you at the local level, it's truly about doing what we can to protect the citizens, and we will continue to do that. We're going to continue to do surveillance and isolation until we're directed to not. We're going to continue to make every decision that we possibly can to protect the citizens of Ellis County. As I'm asking them to make decisions to protect themselves, we will continue to do everything we can to protect them as well.
Has KDHE given any indication as to when they might stop surveillance, if they ever will?
I don't see any realistic change to that plan anytime soon. I have fairly frequent communication with Dr. Norman via email, and I don't see that we will be changing that direction at any point. And what I would encourage you to do is the same thing anybody else that calls my office. Write your legislators, write anyone in a position that's above you, share your concerns with them.
Of the positive tests we had, Jason, are a lot of them asymptomatic?
You know, I'll be honest, I don't know the exact percentage, and I'm not going to tell you I do. There's so much data that we try to keep track of. That's one of them that we don't. But I will say, out of the recent asymptomatic testing or widespread testing, facility testing that we've done, about 25% of the returned positives were asymptomatic right now. Most of them were symptomatic at some point in the past, but we've just gone through allergy season and everything else. They said, hey, I thought it was allergies or whatever. So we are battling a lot of that right now.
So most of these symptoms have not been detrimental too much to the individual.
No, with the younger population, we have not seen, and as COVID has continued, we've seen a reduction in symptomology. We've seen that burden of disease for the under 65 population. We do still have a significant burden of disease with the population over 65, and especially in long-term care, communal housing, anyone that's immunocompromised. We do still see a significantly high burden of disease in that population. So it is something to be concerned with, and something that I will say the long-term care facilities, skilled nursing facilities, they got a few different names, but I will say they've done a phenomenal job of trying to jump through every hoop, trying to do everything they possibly can to keep those populations safe. And they're providing phenomenal care to them now that we do know it's there. We've identified it, and they are taking really amazing measures to try and protect those people.
Commissioner, any questions for?
Doing a good job, giving us great updates. Jason, thanks for everything you do. I know you're tired of preaching about it. I have no questions for you.
I'll email you guys those graphs so you have them, but
Okay. Jason, what kind of symptoms should people be looking for?
oh man, it's everything from nothing to vomiting, muscle aches, pains. I mean, literally, it is such a wide range of symptoms. And you'll have two people in the same house that are married together that are married to each other that are symptomatic at the same time period. They believe to have contracted, and their symptoms are strikingly different between the two of them. So honestly, the predominant amount of symptoms we've seen in the last 6 weeks has been allergy-like symptoms, but it's allergy season. So are we seeing symptoms of allergies with someone who has COVID, or is COVID creating the symptom? You know, it's pretty hard to nail down. The one that has just kind of been universal is the loss of taste and smell. And there's not really very many other viruses that do that to this extent. I haven't had COVID, so I haven't experienced it, but everybody says it is just profound. Like we've had people that are sniffing a candle and it just is gone, or they go to sit down to eat something. And so the loss of taste and smell is kind of a unique symptom for this.
Yeah, that's something that I wondered. As a business owner who's now been affected a little bit through some issues of quarantine and things like that, with completely asymptomatic household full of roommates, I wondered what that looked like in terms of a person who struggles with ragweed season, and the idea that we try to distinguish the two is what kind of symptoms should we look for, and when should people go get tested. So I'm glad you did that.
That's honestly why from the start we encourage people to work with their primary care physician. Call your doctor. Let doctors be doctors. We have phenomenal doctors in this community. Call them, let them figure it out for you. It's the symptomology is extremely broad, and that's why the doctors have, let them do that job.
And you said 63% of our caseload is 18 to 24 right now?
63% of our active cases, yeah. 54% overall.
It sounds like it's running rampant through that college crowd.
So that I hate to hammer on Fort Hays State. I'll tell you what, the campus has done a phenomenal job of making preparations. They have every plan in place. They've been working on this stuff on campus. They're doing a phenomenal job. It's what the kids are doing off campus. But I will say that 2 weeks ago, they accounted for about 77% of our active cases, and now they're 63%. So that is an improvement for that 18 to 24-year-old population. I encourage them, I understand I was there at one point in my life. I probably would have made poor choices as well. So it's, but if they could still have a good time, but not do it at the kegger, maybe have 5 friends that you normally hang out with, and whatever. Like they can still have a good time and do it in small groups, and it will make a large impact. The problem with it in that population is they're so active. They're so involved in our community. Our community wouldn't even be half of what it'd be a great community, but a lot of what we have is because of the Fort Hays State population. Those kids are active everywhere. Mm-hmm. And so that population happens to spread it more because of the number of contacts they have during the day. They work all over the community, and we're thankful to have them. So it's, but yeah, limited in that community will help the overall impact.
Well, and they affect our workforce a lot through the businesses that we all interact with day to day. That's our workforce in retail, in food industry, and things like that. That is our workforce. So when they spread it like crazy, and you guys contract trace them, that's where you see these shutdowns come from. My big question is, what's the end goal with them? If we know that they can't take these mitigating measures that we suggest of them, is the idea that we hope to grab some sort of herd immunity through them and that protect the rest of us, or what do we do? I don't know.
You know, if I had the answer to that question, I probably wouldn't be standing in here. It's that's a broad scale question, and every community across the entire nation is fighting with the same question. We're not unique. Our case spread has not been any different than what we've seen in other college communities. I will say, like I said, if we just look at the numbers, they're doing a better job. I think recognizing that, recognizing the fact that Florida State has taken crazy measures to try and protect those kids on campus. We just need them to make a few better decisions, but we also got to realize that they're such a big part of our community. This community wouldn't be what it is without that population. So working with them, we meet with Florida State frequently to try and come up with ways to help with that. Taking those basic hygiene measures, you know, making sure that they're wearing a mask and wearing a mask all the time. It's like I said, you don't get to take a break and group up with the other 8 people you work with. Like, you don't get to take it off when nobody's in the business and stand and talk. Like, that's where you get it. And so if everyone just takes a few measures like that, space out, not group up, if we can get them to stop maybe hitting up the keggers on the weekends, but that's probably for some other reasons. They should probably study or something. But it's if we can all take some of those measures, and it's not just that population. The reason that other people in the 40s, 30s, 50s, 60s, whatever, the reason why they're getting it from that population is because they're also not taking those measures. So if everybody takes some basic health measures, the end goal is to try and get through this as best we can with the fewest number of impacts, the lowest number of cases, until we can hopefully get some form of a vaccine, because herd immunity is a long, long ways away, and that's not a realistic plan for any short term.
So explain to me, I know we did some asymptomatic testing at the college. How does that look in terms of our percent of positive? Is that what helped a bit? Or you said we did a lot of testing in some of our long-term care type of facilities too.
Sure. Yeah, so it figures in. The testing that you're talking about at Florida State, the asymptomatic testing, is Florida State's partnered with CRL Labs to do a saliva test. It is a PCR test, but it's a different form. They don't stick the they don't stick that nasal swab all the way back in your nose. But we do get all of those tests. So we get the negatives, we get the positives. So that does help with the percent of positive. But really, their Florida State Student Union has conducted almost as many, or they've conducted a couple hundred in-person PCR tests. We've got all of the medical community that has done a phenomenal job of just really testing anybody and having that capacity to test. So it's all of that coming together to make sure that that we keep that percent of positive at least under 20%, so we at least kind of know we can use it as a guide.
So what does our pandemic plan look like? At what point should we be concerned as commissioners, as the County Board of Health, where we have to add mitigating measures, or that our plan suggests that we do,
Sure.
depending on how we interpret whatever data?
We're already there. I mean, we're already into phase 1 of our plan, which is basically what we're already doing. It's recommendation of mask, it's recommendation of social distancing, it's quarantine and isolate. It's all of the measures that we've been taking for 8 months at this point. The next benchmark that we would look for or talk about would be 1% of active cases and a percent of positive over 10 to 12%, but hospitalization and hospital capacity figures into that. And so far, we haven't seen a hospital capacity issue.
Good. So 1% of active, which would be around
Percent of the total population.
so 280-ish active
Yeah.
cases where we start talking. Okay, that's just what I wanted to know, so I could keep an eye on it as you guys report, and that's pretty much what I do, is just make sure that caseload is okay. On occasion, I send you a message about the hospital and how they're doing, and I think we're really lucky to have Hayes Med Center, and I think we're really lucky to be outside of that original time frame of when we did not know a lot about COVID-19. And so I imagine the medical facilities are a lot better at treating COVID-19 than they were originally.
Sure. Yeah, they're doing a phenomenal job. We've got a great medical community. All of our medical community. They are getting better at treating COVID. They're keeping people off events. They are giving them different treatment regimens. They are always exploring new drugs, new interactions. But they're nationwide. We've seen the mortality index, or basically the death toll, whatever you want to call it. We've seen that decrease as far as a percentage of active cases. So as we go, we are getting better with treating it. The problem is we're getting worse with not getting it because people are tired of doing all the things that we've enforced on them since the start. We all knew in Ellis County that the closure was too early. Well, now we're paying the price of that. I don't think if we asked the community to do that again, I'm not so sure they'd do it. And so the problem is we are now at the highest point that we've been in the entire pandemic, and people aren't willing to take as strict of measures as they were at the start. And so it's gonna be a long couple months. It's gonna be a long year. I don't know what the end of this or what the resolution of this is, but we'll get there together. Community will be strong at the end of it. People will eventually figure out how to all work together to get through this. And that's really what it's going to take.
You know, I think you made a really good point there as far as, the idea that we were shut down too early and stuff like that. And I think that if people knew what they were fighting or maybe had a consensus or an agreement about what we were fighting, it might be easier. As you alluded to, I don't know that they would. I would almost go further as a small business owner and say, I don't know if they can afford to. And when you get to that, you get to a whole different level of desperation. And so, I appreciate all you guys are doing. I know you guys are just beat to death with this contact tracing. The number of people that I know that have been called by a contact tracer in Ellis County, and I don't feel like I know a ton of people, but that have told me they have been, alludes to the amount of work you guys are doing. You look more tired every time I see you, Jason.
Like I said before, I'm not worried about me. I signed up for this, but staff didn't.
Yeah.
And they're tired. EMS staff's tired. Everybody. Every business is tired of this. And what we're fighting is fear. We're fighting fear of the virus. We're fighting fear of losing your business. We're fighting fear of the economy. We're fighting fear of not making the right decision. There's not a single person that's not scared of COVID in one way or another.
Yep.
It's just what part of it scares you the most.
Now it's the time for us to bind together as a community. We thought we were doing it early, and we didn't have the coronavirus yet. Now we do, and now it's really the time for us to bind together and do the right things for each other and keep our economy vibrant and going. I think we'll do that. I think we're a resilient bunch. I just think that maybe we got this false sense of security for a little bit, and now it's here. So, and thank God we have better data, we have better abilities to fight this, and you guys had a little more time to prepare than some of the places on the coast. So, I think we'll do fine. Just got to bunker down here for a little bit.
Mm-hmm. All right. Questions, Dean?
Nope, doing a
Jason?
good job for us.
Thank you.
Thanks, Jason.
Keep up the good work. Let us know if you need something. Okay, moving on. Resolution 2020-15 regarding labels on ballots. Donna.
Thank you. We are just renewing our current resolution. As you can see, 4 years ago, we named our prior equipment, which was the Ivatronics, and now we're dealing with the new equipment, which is DS200. And I did speak to the vendor, and he states he highly advised against anything added to a ballot stock. It will jeopardize the sensors and your equipment. Mm-hmm. So they highly, even for using pencils, They even tell us not to use pencils in marking the ballot because some of that lead could cause problems in the machine. So in the instructions to the ballot, you're supposed to use ink. So they highly recommend it. So we hope that you will go forward and maintain, we've made an investment in election equipment, and we want to keep that election equipment going for as long as we can. Thank you.
Have you seen stickers show up on any ballots so far?
In my time, I have not, and I hope we don't, because it just jeopardizes your equipment.
Sure. Questions for Donna?
Donna, what's the issue with the law in terms of people's intent? I know intent to vote, your intention as a voter is the absolute utmost to us in a society. What's the issue with that? And obviously, we want to protect this equipment. We don't think it would be too big of a deal for people to write whatever they needed to on any given
Right.
ballot or mark it the correct way. But how does that work with state law if we pass a resolution like this and then we end up seeing a bunch of stickers that say something? How do we
Yeah,
handle that?
I hope we have, people will not do that because we're trying to make it known that we do not wish for stickers to go through the equipment. I've been asked about the mail ballots. Do you run those through? Well, every ballot is tabulated through the DS-200. So it's very important not to. And when you talk about the intent of the voter, when that board that reviews all of those write-ins, we make it very clear, and the law makes it clear. And we have a checklist, and that is very clear. What was the intent of the voter? The name might be a nickname. They might just have the last name. So, that they have to make that decision. I do not make that decision. It's that board.
So my big question is on this, if we do this resolution, will that make those stickers, labels, whatever somebody might have done, completely invalid in our election cycle for whoever might be the canvas of voters?
Well, I hope it makes it clear that our intention is not to have stickers on that ballot because it jeopardizes our investment of our election equipment.
Would you run a ballot with stickers on it?
That's one thing that Chris told me, my vendor with ES&S. He said, you really should test it. So probably I will be testing it. Bobby and I will probably give it a test. But he said, you do not want to do that. I don't want to jeopardize our equipment. So I guess I feel a little nervous doing that because we try to take utmost respect of our equipment.
Absolutely.
Well, we just bought it, so we want it to last as long as
We do.
possible, especially when we're talking about paper ballots and the
Right.
future of the state of Kansas, which is, your ability to do some sort of back checking on anything. But, I'm happy to work on this resolution because I think that it'll mitigate some of the problems. I just wonder, when we talk about intent of the voter, what ends up happening, and if you know of any case law or things of that nature through the state Supreme Court where, or maybe this is a question for Bill, how that ends up. I mean, voter intent, I guess, is a really tough thing, and it's just for the canvassing board to decide, but with as many ballots as we get, it would not be real feasible to start trying to count stickered ballots.
I don't believe that's an issue that's ever been addressed by the Supreme Court, but I can certainly look into it.
Okay. Well, as I say, I'm happy to make this resolution. I think we should keep stickers out of our machines.
Okay.
So,
Yes,
yeah.
please come up.
At the beginning of my campaign, we did ask about stickers because we knew that it was said several times that it was onerous and took a lot of time to count ballots. I will point out that there is equipment that is able to use stickers, so perhaps that investment might have been different because they do exist.
Is that equipment that is recognized and approved by the Kansas Secretary of State?
So because other counties and states use it.
Okay, I have not heard that.
But my question becomes, if we're not allowed to use stickers, if ink is okay, we would ask for my campaign if we are able to create pre-inked stickers to keep in the polling booths for people to use in lieu of stickers, because if the issue with stickers is just that it gums up the machine, pre-inked stamps should not do that.
No, I would be totally against that, because we had in past used a stamp to show the process of the election process of that ballot, and they very much said not to discontinue the stamp because of the ink, so now the girls sign it, initial it at the
Because of
bottom.
the equipment again.
Right, that is what we were told when we looked at the equipment.
So I guess then my question becomes, if the issue is simply the equipment, then in what way can we provide voters who might want to write in my name with an easier process of doing that?
I would just encourage them to write your name.
So because of our equipment, there's no other option? That's what you're telling me?
Well, I mean,
If I can't send stickers to people who ask for them because of the equipment, and if I can't use different kinds of ink because of the equipment, then it is solely because of the investment that we made.
right, because the ballot stock is not to have anything added to it.
Okay.
Thank you.
You know, I think I might reiterate from that. I mean, this is obviously brand new equipment. I mean, this is top of the line, you know, obviously very expensive equipment. It wasn't equipment that we didn't spend good money on to try to get. What I might question on the deal is, you know, obviously in terms of a write-in campaign, if this were to happen and stickers were to show up, even though we've done a resolution, as our counselor has said, we might be running into an issue of whether or not we count those or not, and whether or not.
I don't mean to interrupt you, but regardless of my feelings on this subject, we would not send out stickers for my campaign in
Okay.
particular against a resolution. So
Okay.
if your concern is on my account, there's no need. We will follow the rules.
Okay. You know, but I think for the long term, I think it's an important thing to consider. You know, it might even be something that we ask for some sort of a ruling from the Attorney General about. I don't want stickers in our machines. Our machines are obviously not designed for them. But is there any way that we could ask the Attorney General or request some sort of a, you know, call from him on whether or not that would be an okay way to run a write-in campaign and/or as these.
As far as counting them, you mean individually, like if somebody put a sticker on, then Donna's group would count that individually versus running it through the machine? Is that what you're going to go?
It seems like that's the intent of the voter law is a hard thing. Now, an adhesive to a piece of paper is also a really hard thing in terms of where it might be on that piece of paper after we run it through the machine, how it came through the mail. I think there's a lot of questions here. I wonder if the Attorney General would be willing to give us an opinion on such an issue. And I'm happy to pass this resolution. I think this resolution is important for us to save our equipment. But what if someone just blatantly did not want to follow said resolution, and then we had to deal with another Supreme Court ruling, which is voter intent? So,
You need to frame the question for me.
can
There's a
we?
process you have to go through to request an Attorney General's opinion. There's a number of factors involved.
I think we should
And-
consider that as a board, is to ask the Attorney General his ruling on even this resolution and how it would apply to voter intent. I don't know if he's ever answered any of those questions, and obviously they can change. Attorney Generals can change, but you know, maybe that's something we consider for next meeting. Like I said, I'm happy with this resolution. At least when it's passed, he could see the resolution in full and then give us an opinion.
It would not be my recommendation to ask for Attorney General's opinion after you passed a resolution.
Okay, okay. So,
Very well come back and
and strike it down.
strike it, but I don't think that's the case here, and they may elect not to even issue an opinion.
Okay,
I did ask the question to my contact at the Kansas Secretary of State's office, and he said that's up to the county election officer because the county does the purchasing of that equipment. And that's what we want to preserve. We want to take care of the equipment that we purchased.
that makes a lot of sense, Don. I mean, keep it as local as possible and make the decision as local as possible. So, I mean, like I said, I think we go forward with this, and I imagine we leave it to somebody else if they decide that the Attorney General should make a ruling on it.
We can always do that.
Okay.
Okay, you want to make the
Yep.
motion?
I move the commission approve resolution number 2020-15.
Second.
We have a motion and a second. All in favor, say aye.
Aye.
Motion passes 3-0. Okay, the next item is the 2021 health insurance. Darren?
Good evening, Commissioners. Darren Myers, Director of Fire and Emergency Management. Before you tonight is a agenda item. Let me pull it up. In regards to our health insurance for 2021 for county employees, I was reviewing this a little earlier, in the first sentence, and this whole entire discussion was a little bit unclear, but just break this down how we've come to the point where we're at. Ellis County has seen about an 8.9% increase in health insurance over the last 5 to 7 years annually, which the more it increases each year, the more it's going to increase the next year. And it usually is about $200,000 to $300,000 a year. In what we pay in towards premiums compared to what the Blue Cross, the state employee health plan, actually pays out, we average over the 4 years that I looked about $443,000. So what that basically means, if we're paying in $1 million in premiums, they're only paying about $550,000 out in claims that employees or their plan members have. We pay more than $1 million a year, but just that's how that comes into play. So with that, with the increasing costs and being as part of the state plan, which is a 3-year contract, the commission has, over the last couple of years, tried to make different options to help absorb those costs. As of 2019, the cost share was 92.5% that the county paid. As of 2020, it's an 89-11% split, and next year the commission gave the direction to change that to an 86-14 split. So the county's paying less, the employees are paying more. Moving forward, at the beginning of the year, we started discussing at the end of the 2020 here, our contract comes up and we have the option to be able to opt out. We have to opt out to the state by the end of September if we're going to look at a different health care coverage come January 2021. So we've met with the Wage and Benefits Committee. They spent a lot of time with this. We've met with about 6 different vendors, I believe it was, 5 or 6 different vendors, and they gave us different options from being fully funded. We looked at staying with the state plan, partially self-funded, completely self-funded, and mixtures of both. And we come out to the conclusion that we should move forward with Julie Armour and Freedom's Claims Management Incorporated out of Great Bend. Julie has been here several months ago, I believe, and presented some information to the commission. With that point and with the intent of her potentially working with us in the future, she went out to bid for Ellis County for all 3 of health, dental, and vision insurance, and got responses back, and they were actually good enough that they would give us the cost estimates far enough out in advance and guarantee those premiums up to January when we switch over from the state to a new insurance premium. The way we have it set up, it's almost kind of a fully insured, partially self-insured combination policy. What the proposal that she has put together is basically, I'll give you the exact amount. For a single individual, Plan A, which is the traditional health care plan, in 2021 it'll be $831.50. That's total cost, and you'll split. However, on those plans, if we stay with the state plan, it's going to be more. On average plans, it's about 11% more than what we have set up with Freedom Claims, FCMI. So if we stay with the state, we're going to have significant increase in health insurance compared to what we have planned here with Julie. But of that $831, you do your cost split. And for that same exact policy, for the umbrella policy with Blue Cross Blue Shield, it's $485. So it's $485, which is roughly just over, about 50, that's probably about 55, 58% of that total premium is being paid for your umbrella policy. The second part of that is what's called a medical expense reimbursement program, which is kind of a self-funded portion of it. Mm-hmm. And in relation to the state, if we pay them that full $835 and there's no claims against it, the state keeps all that money. Mm-hmm. The way we would do it here, at that $835, we would pay Blue Cross Blue Shield $465, and then you tag on this expense reimbursement program that you may or may not use all of it. If you don't, it stays in Ellis County's bank account. It continues to build month to month, year to year, as well as gain interest. So that kind of brings us into that next phase is, well, how much is that medical expense reimbursement program going to cost us? The way we have it set up, the Wage and Benefit Committee helped design the levels of co-insurance to premiums for prescription drugs and everything. Maximum total liability is about $689,000. That means at $689,000, if every single employee and every single person that they have on their plan, kids, spouses, would hit their deductible, it would cost us $689,000. And we would have to fund that at 100% to be able to cover those claims. Now, we all know that's not going to happen, that every single employee in Ellis County hits that deductible. If you look over those years that I refer back to between 2015 and 2019, we average overpaid about $445,000 a year. If you take that times those 4 years, that's about $1.6 million that we would have kept in our Ellis County accounts to help pay for insurance. Mm-hmm. Moving on, if we were to continue to stay with the state plan, what we didn't budget, or what it would increase our budget from 2020, would be about another $262,000 that it would cost Ellis County, as well as about another $42,000 for our employees on their cost share side of it. If you look at that medical expense reimbursement program that we have set up, if we hit that maximum liability, or if we only hit half that maximum liability, that would means we'd have about $350,000 that we would be keeping in our accounts each year, which is somewhat similar to the state based on premiums. That's just saying 50-50. However, their history from what they have with other cities and counties in the state is usually between 20 to 40% is where they land at. You have a really good year, you're only using 20% of that. That's only about $120,000 out of that $600,000. So we'd be saving about $500,000 alone in that portion of it. I will say that Julie was planning on being here tonight to represent Freedom's FCMI. However, she was a close contact to another case in a different county, and she could not stay, and that would postpone for her being here. She may have been able to be here next Monday, but if not, it would have been the 3rd. And I felt that that was too long to push off, just in case the commission felt differently about this. So what's this going to cost Ellis County to have a consultant run and manage our COBRA payments, our payments to Delta Dental, to Vision Direct, and to Blue Cross Blue Shield? It's $17 per employee per month. That is included in that medical expense reimbursement program, which is 94% funded. So there's no additional cost. It's built into the plan. And when we were looking at all the different of the consultants, her and one other proposal, I think the closest next one was about $1,750 a month. So they were right there in the same line. We just felt that this was a better long-term investment. If we can save $350,000 a year, that continues to build. What that means is next year, we could either continue to build it, or if increases come up, the commission at that point can say, well, let's take out 100,000 of that 350 we just rolled over, and let's absorb the health insurance costs or increases that we have. Another good point to this that I will state is, as of now, if we were to pay that full $835 to the state, next year, they're going to have a 10% increase. That's $83 a month that insurance would increase. With this plan, only $485 of that $835 is part of that health care premium that we're paying to Blue Cross. So if that goes up 10%, your monthly increase is only going up $48 instead of $83. So our percent of increases will also be reduced in the following years as well.
Question for you.
Yep, I will be quiet now, I'm sorry.
When we look at this insurance and in comparing this plan, Blue Cross and Blue Shield as the insurance, with the state plan, are the deductibles and co-pays similar or the same or less or more?
Co-pays are going to be $15 per visit cheaper. Specialty office visits are $10 per visit cheaper. All the prescription drug benefits, this is for Plan A, which the majority of our employees are on. They're all the exact same. However, when we look at your co-insurance, your deductibles, and then your max out-of-pocket, that's where if you actually use to the max, that's where your savings is going to, either your savings or your expenses are going to be. So for instance, the traditional plan, a single employee, their max out-of-pocket with the state plan would be $5,250. With this proposal, by having that medical expense reimbursement program, is being reduced to $2,500. That's over 50% reduction in your max out-of-pocket. For a family, depending on what type of claim it is, it's usually about $9,000 max out-of-pocket. We're dropping that down to $5,000. So for a family, it's not quite the amount of savings, but it's a larger savings potentially for the employee. The Plan C, which is the high deductible plan, you're basically going from a $2,700 max out-of-pocket for a single down to $1,800, and family is $55 down to $36.
So in a nutshell, the employees are getting better insurance,
Correct.
and we're going to be paying less in premiums, or we're saving money.
Comparing to what we would be paying in
compared to what
2021.
we would be. Plus, we're putting money away to be used for the future, for whatever medical expenses we may need it for, if that is premiums or whatever.
Correct.
So it sounds like a good deal all the way around.
Well, when we first stood up here, or when I first brought this to the commission several months ago, it said, I kind of explained it, none of us believed it, that it could be a win-win-win for everybody. County could be paying less, the employee could be paying less, the employee could be getting more benefits, and the county could be putting more money aside for future health insurance costs. And we checked all 4 boxes and
Yeah.
came out smelling good.
Questions for Darren?
I actually called Julie also, Commissioners, and visited with her on some questions I had, and Darren did a great job of covering it, and she answered all my questions, and
Okay.
I think it's a good plan, good program.
Dustin, questions?
You know, essentially, I think we're using our financial strength and size and viability to help our employees out. I think this is something that is utterly important to our employees. You know, we're still an aggressive payer of their health insurance. I mean, 86.14 is well above what is normal in the marketplace. You know, I actually got some statistics about what is a normal health insurance coverage, and it looks like the average employee contribution to health insurance is 17% for a single coverage, which would bring us down to about 83. So we're close, but what happens is when the family hits, 29% is average for the family. So I love that we're aggressively paying the health insurance for our employees, keeping them healthy, making this an attractive place to work. But I also love the idea that we're able to find some savings here and use our financial strength to help our employees and help ourselves, frankly. Instead of Blue Cross and Blue Shield of Kansas, as much as I like that company, I can imagine that we were in more of a financial strain than them. And frankly, this all came about because of the Affordable Care Act. We just kept getting cranked year after year. 8-10%, and when you see that and you pay the percentage that we do as a county, we all of us saw the financial situation that it was putting us in, and so it's great that there's companies that are getting aggressive with the numbers and understanding how they work, and frankly, I think that there's even more possibility here. But I think this is the way to go now. I think it's the way to put some money in the bank. And then once you have a little bit of a cushion that we built up based on our financial strength, you might even be able to be a little more aggressive with it.
Sure.
And not hurt our employees. I think keep them almost at the same level that they're at, but put a little money in the bank and give yourself a little cushion to, all insurance is essentially a bet. And so as soon as you guys have a little financial strength, you can really probably do really well for our employees over the years. So I'm excited about that.
Yeah. Do I hear a motion?
I move to allow the chair to sign a contract with Freedom Claims Management Incorporated, allowing Freedom Claims Management Incorporated to manage the health insurance benefits for Ellis County starting in 2021.
I second that.
We have a motion and a second. All in favor, say aye.
Aye.
Motion passes 3-0. Thank you, Darren.
I will wait until after the meeting. I have all the forms here for you to sign. I'll just wait until afterwards and we can
Okay,
tackle those.
I think I signed a lot of them for Donna.
We, Mr. Jeter, I forgot to mention that, had a couple suggestions in her contract that we changed a couple of
Okay.
verbiages. So they're not verbiages, a couple sentences in that contract. So I have the new one that she got
Okay.
me yesterday or today,
Oh.
and we can get that updated.
We'll do that.
Thank you.
Okay, next on the agenda is the Ellis Carriage expenditures. JD?
Very good, thank you. Actually, we've got a couple of items regarding the CARES program. We have received feedback from the state, and out of 120 some programs that we had, only 12 gained comments back. And with that, that means that the things that didn't get comments back, we can go ahead and start moving forward on. One of the ones that we did get comments about was the ambulance. However, their comments were basically along the lines of, can you really get that done in time? And so that really underscores our need to expedite. I believe in one way or another, I've visited with either all or most of you about the need to expedite. We already know what those items are, and the amount that we have budgeted for those out of the CARES funding. And we'd like to get moving on all of those and get your permission to go ahead and move forward with those.
Okay. Do you have any questions for JD?
I didn't think they probably read them that close, but evidently they did to kick a few back, so.
So JD, this was just about our ability to get this implemented in place before December, and this question is just a matter of us okaying the purchases ahead of time.
That's correct.
In order to make sure that it happens. Ventilators, laptop licensing, health department generator, EMS ambulance, and then the big one, the CAD system.
That's right. And it's only those items. The rest of them are under our purchasing authority, and we can go ahead and move forward with those. We're also asking for a 10% approval for 10%, just in case it comes out just a little bit more than what we're estimating at this
Okay.
point.
And absolutely no indication that they would not approve of these purchases
No.
Okay.
No, there were, we received no red flags. Apparently there was one county that did receive no, stop, don't do this. We just received the 12 comments, and almost all of those are we just need to explain a little bit more what
okay.
the program was. So, and like I said, the ambulance was more of a, are you sure you can get it done?
You know, this is such a great mitigating expense over the future for Ellis County. And I imagine the state was seeing so much information that I can't imagine that they were even able to go through it well. So the fact that they were just making sure that we could get it done, and as long as, I mean, I see the big ones as mainly Jason issues and the ambulance, make sure that thing is an actual ambulance and is one that can be delivered here. You know, I'm happy to allow us to get going on it so we don't miss out on this opportunity to save the taxpayers in the future in a different way of taxing a lot of money. So,
And one other comment I might share with you too, of course, the CAD system is by far the giant project. Darren and I are kind of taking a divide and conquer. As you know, he does a great job. So he's going to head up our CAD RMS initiative. I think they've already had a meeting or two and going to take a trip to Saline County, I believe this week, isn't it, Darren? Friday, maybe? And to see how their system is operating. So we're kind of getting the ball rolling, but this would be nice to get your approval too in advance.
yeah, if you ever want to see Darren's eyes light up, let him talk about this CAD system to you a little bit.
Okay, do I hear a motion?
I move to allow staff, pending final state approval, to enter into agreements to purchase the CAD RMS system, ventilators, laptops, generator, and ambulance, and with an allowance of up to 10% above the estimated cost.
Second.
We have a motion and a second. All in favor, say aye.
Aye.
Motion passes 3-0. Okay, then we have the Ellis Cares Memorandum of Understanding.
Yes, sir. Thank you. And thank you for the last measure as well. This memorandum of understanding, we have, Bill and I have been working together on that, and plus receiving feedback from seeing what other counties are discussing as well, and then implementing what we think makes the most sense for us. We've included a copy of that MOU is on the second page. We've developed this as a mail merge, and we're kind of not doing as many whereas clauses as the state template has. They've got like a couple pages of whereas clauses. Ours is just to the point, and as you can see on the front page, it makes it very easy with our mail merge to see who the recipient is, the program number, et cetera. So be easy for us to get the information when we need to later. The provisions that we are proposing to include in this includes, as shown on the cover page, a purpose and use of the funds, the type of documentation that's going to be included. Like, for example, if they're issue, and fortunately, most of our issues are loss of revenue. So, and we like those because they're easy, because they just provide the financial statements that back that up, and we're kind of done. We issue the payment to them, and there's no more follow-up with them. It's the ones doing projects that are going to take a little more watching and helping, and they'll turn in receipts on the tail side. And so our MOU will indicate what type of documentation. We do have a few, I think maybe 4 to 5, that actually have both loss of revenue as well as also doing a project. So there'll be a mix. They also are acknowledging that our deadline that we set is December 7th. Someone asked me the other day if we did Pearl Harbor Day on purpose, and I think it just kind of turned out that way. And that they acknowledge that they understand that we have to turn the money back to the state, and so therefore they're acknowledging that they need to return funds back to us that are unspent by December the 7th. And so we want to make that clear, that they understand that they need to get the project done as soon as they can, so they can so we don't have to have a return of funds. We also, as we discussed at an earlier meeting, that they be current on all county tax obligations. One piece of policy also that we've added to this that I'd throw out to you is in talking with Amanda Trin in the Treasurer's office, that they also perhaps would be given the option that they could be in a satisfactory payment arrangement plan on their taxes. And so we'd suggested 20%. Amanda had indicated that they would be comfortable with doing. We also indicate that they would comply with all reporting requirements and audit inquiries that the state might require us to do. repay any debt incurred if they purchase or use the funds in an ineligible way, that they comply with purchasing procedures. They get 3 quotes whenever possible. If they're sole source, kind of like here, they would write me a letter. I've already had a couple of those that would write me a letter saying, we ask that we be able to do sole source purchases because of reasons X and Y, and then I respond and we put that in the file, so it's in there for audit purposes. And then that they agree and attest that they're not, because they can't get other funds for the same project, so they have to agree to that, and that they also acknowledge that they'll have to these reconciliation documents we provide, they could be made available to if pushed on it. So we don't believe that it probably would be a open records request. However, it could go through court and it could be made available that way. Bill and I, once again, have worked together on that as far as financial statements. One of the options that we plan to give to the sub-recipients is a CPA-signed statement indicating the loss in lieu of a financial statement. So if their CPA attests that they've suffered a financial loss of X dollars, then they could include that in lieu of the financial statements. And then the final thing that is not in here yet, but Bill and I have been discussing just today, is a savings clause, we might call it, that would cover us in the event that the business either goes out of business or files for bankruptcy, or if they sell the business. So we may have one of those actually occurring.
Mm-hmm.
So I'll stand for whatever questions or discussion you'd like to have.
Any questions?
How does the sell clause look? Does it go to the new owner of the business? Does this funding go to them?
I think what we would suggest is that it would not.
Okay.
The loss occurred with the previous business, and if they're no longer in business, even if someone else bought them, they weren't the ones that experienced the loss. That's our thought. It's a policy thing, and you all can certainly, if you'd like to do it differently, that's fine. But that's what we would recommend, or I would recommend.
It makes sense. Seems like there should be equity in any kind of business that's purchased, and you're purchasing it based on probably what is an economic loss to the owner now because they're buying it after said loss or during now, which is not the greatest time in the history of the world to buy a business that just took losses. So couple questions. The 3 quote things makes a lot of sense to me in terms of how we run things as a government. It's a little tougher, I know, in private business, and mainly I'm thinking about this in private business. I'm also thinking about this CPA signature loss instead of financial statement issue. I'm trying to figure out how we avoid fraud in a situation like that. I can understand that a CPA is not going to risk their license or their ability to practice as a CPA for the sake of one of their clients to try to give an indication of loss or whatever. But I think of some of the money that has been shelled out, and I think most of the for-profit entities, I say most because there are some that weren't that way, most of their requests were about a loss of income. Mm-hmm. It was about what happened to them during a shutdown process and COVID-19 and all this stuff. I just wonder what that CPA, paperwork looks like as opposed to financials. I just know that my banker would not allow my CPA just to tell him that I have said amount of money or whatever. So although we're not bankers and we're giving out grant money to try and get the economy going. So it's a little different from our perspective than theirs in terms of loaning money or what have you. So, those are my couple questions. I don't know, the 3 quotes thing I know is extremely hard, especially in building, which I know one of the projects was about building, an outbuilding or something for drive-through. 3 quotes from contractors in Hayes, Kansas is nearly impossible in a timely manner, which I know this is all extremely timely, and I question whether or not that can be done anyway, but
they can ask to be waived from that 3 quote too.
and that's when they give you their reasoning, right?
That's
Okay.
right. Yeah.
Mm-hmm.
If
Okay,
that's
so that-
okay with you all. And
No, that makes
and I'll
sense.
and I'll respond, and then we'll put the response in the file then.
Sure.
Yeah.
And Bill, I imagine you have an idea how you want this CPA paperwork to look, just to cover us in terms of if we were ever to have any kind of audit come along the lines. Not that I anticipate that.
I would anticipate just a written statement or letter from the CPA that they've examined the records of this company and acknowledged that there's been a loss of income.
Okay.
And what that is and the period of time.
Okay, that's my big
And
question.
And in that regard, we've got somebody on the line for that
Okay,
statement.
Mm-hmm.
as opposed
many-
to us having to shuffle through financial statements. Yeah.
Right.
I think that makes sense. Do we have a time period set up? Because I'd imagine there's a big window here. From the time we start knowing coronavirus exists to the end of a shutdown to now to the end of December, do they have the opportunity to keep losing income because we gave them income? What is that time frame, and is there anything in the CARES Act that makes us understand that? Whereas just by December 7th we go, these guys had a bad year. Well, didn't we all?
Well, I think, I guess my thought would be that at this point, they need to be able to show us something year over year,
Okay.
whether it's first quarter over first quarter or first and second quarters over first and second quarters.
Okay.
So I think that makes it pretty hard for us to try to go back, after the whole year is over and then try to figure that out.
So yeah,
But-
maybe first half, as long as they can show us they're losing income, and then maybe it's clear up to that deadline, that December 7th deadline. Did you lose the amount of money that we were able to kind of make up for you? And if you didn't, please get it returned. And what happens with the return money? I know it goes back to the state. But
So it will, so we'll receipt it back in. We'll keep track of it. And then from what I understand right now, you all will have an opportunity to reallocate
Okay.
that funding. And so we're keeping in our back pocket some additional public projects that we think would be qualified for that. And I suppose if you have other things that crop up in the meantime, let me know and we'll put it on the list too.
one of the few things that has made sense to me through the CARES Act. If the money comes back, we can reallocate it. Okay, no. I
And
think-
we said December 7th, I kind of joked about that a little bit ago, but we have until December 30th to turn the funds in. That's why the December 7th, trying to give people an opportunity to get their projects done and get it all closed out, but not wait too late, so we still have an opportunity to do a little bit in December before
Okay.
we have to turn those monies back.
Okay.
And our plan is to have those expenditures ready to go and approved by the CARES Act in terms of if money is returned.
Yes, it'll be reimbursement type of things that we'll be able
Okay.
to, right.
Okay.
Okay. Do I hear a motion?
I move that the proposed Ellis CARES MOUs and associated policies be approved and the county administrator be authorized in conjunction with the county attorney to make any small modifications as required.
Second.
We have a motion and a second. All in favor say aye.
Aye.
Motion passes 3-0.
Mr. Chairman, before we move off that, I failed to mention one other thing that's related to this. So the MOU is one of the pieces of paper that's going to be required that the subrecipients fill out and we have in their file, and then we'll release the payment. W-9 is another example. We're going to require those all up front so their file is complete. We don't have to go chasing them down after the fact. But I wanted to ask you, though, about the event that we have I'm hoping we'll have a lot in the very beginning, but those could kind of trickle in over a few weeks. And as you all know, there's sometimes we have some time between meetings. So I was visiting with Bill just prior to the meeting. We may wish to come back to you all, and maybe you could give me feedback today about the event of, would you consider approving us to issue payments to all the recipients that you've already approved when they have completed their files? And so, in other words, as we currently do all of our accounts payable, you get the listing, the APTL 40 that Bobby produces, and you approve that, and then we issue payments the next day. But there can be a couple of weeks in between times, and so I was curious if we give you a schedule of payments in advance, if you might consider approving those, and so then when the recipient's files are completed, we would be able to go ahead and issue payments to them.
I know, I wouldn't have a problem with it. That just ensures some continuity, so it can keep flowing.
Just accounting, I mean, it's
Yeah.
accounting practice.
I think in lieu of the idea of the CARES Act and speed, I think we get those payments out immediately, because otherwise we could risk some of these projects being done and/or
Fantastic.
businesses
By that
not
December
doing well.
7th anyway, I mean, by December 7th, that's gonna be a problem if you got a bigger project.
Yeah, I think you have consensus here. Let that money get out there. I think that's the point of this program.
Okay,
So-
very, we need to bring that back next time. We'll bring that back next time for formal approval.
Okay.
Okay, thank you, gentlemen.
Okay, then we have, next is the county administrator report. JD?
Okay, thank you. We'll keep today relatively brief. We've already covered the Ellis Care update that I was going to give to you, with one exception. We anticipate getting a phone call this week from the individual that the state has named to our region as our geographic region as being a technical advisor. So they'll call and they'll follow up with us on those 12 items that I mentioned earlier. And I think I already have responses ready on 11 of the 12. So I'll be ready whenever they're ready to call, and so we'll be good to go as soon as we have that conversation, I think. So I think we're in pretty good shape. I was very pleased. So that is that. I wanted to mention to you that the LEC elevator project is complete. There's substantially complete. There's still a little bit of work, but it is operational now, and so it's good to have that done. We will have at the next meeting kind of an interesting meeting. We've got a couple of our directors that will be present. The county attorney, Tom Drees, will be here to talk about his transition planning that he's currently working on. We also will have Lisa Ree from the appraiser's office to give you an update on some good things that have been happening in her office as well. The Nicodemus Historical Society will be here to talk about their project. They're moving forward in a fairly expeditious manner. We'll have the 2019 audit is going to be ready, and so that's on the agenda. We have Vern is going to propose an extension of the contract for hauling services. It looks like we have a pretty good deal there to consider. And then we also, back to the CAD RMS system, we're going to propose permission to modify the dispatch room as part of that program. So we'll have that on the agenda, and then the item that we mentioned just a moment ago. With that, the other thing, it's kind of turning out that it's working out this way. Vern agreed to move his one item on the hauling services to the 14th. And with that, the 21st is going to be a fairly light agenda, and I'm hoping to attend the Victoria City Council meeting that evening. And then the second meeting in October, kind of the similar type of thing, and Shenzhen City Council. I believe Dustin's going to attend with me on that. So that's it for tonight.
Okay.
Thank you.
County Commission reports. Commissioner Hazelhurst.
Well, we get a KAC meeting for the first time in forever. We don't have to attend by Zoom. We all have agreed to have a face-to-face meeting in Salina, Kansas at the Chamber of Commerce building a week from this Friday. So they put their little doodle poll out last week, and it was an overwhelming majority that we're all going to meet face-to-face, since last time we had was February. So everybody's excited.
Why, sure.
No mask required. That's all?
Okay, Commissioner Roth?
Just one thing, Leadership Kansas is coming this week. We only have 4 people on quarantine out of the whole class, so we'll have 25 Leadership Kansas participants in Hayes early Friday morning. Or I say early to you, Dean, is 5 a.m. They'll be here about 10 o'clock.
Days half done already.
They're driving from Garden City, so
Good.
you know. But they will be here. If either you two, JD, anybody wants to join me, Representative Wassinger and I are going to give a welcome to them. It's just a short 5-minute, 10-minute deal. Welcome to Ellis County. But as they get off the bus from the hotel, they're going to go to the hotel initially. We're going to have Fort Hays buses bring them down to the brief space. If you guys want to see these people and welcome them to Ellis County, that's a perfect opportunity. And then we have a possibility for a meal. It's going to be we're going to do a traditional German wedding feast for them on Friday night. And it's going to be from different restaurants in Hayes that do a German meal, at least one German piece in their restaurant. We're still working on the space, but I think my buddies at the Fox might end up cutting off a section of the Fox for us to do that. So all you'd have to do is let me know. I'll make sure we have a table for you. I don't know if the city commissioners, Hayes City Commissioners, hear this. I'd be happy to have any of them come too. So it's one of those that is a good opportunity to meet people from all over the state. But I'm excited to have them here and excited to show off the history of Ellis County, the productivity. We will give them a tour of Hess. We're going to go out there, which all 3 of us have been out there to kind of see how impressive that is. We'll talk about oil. We'll talk about agriculture. We'll talk about water, which is an essential resource to the city of Hayes and something they've been working on for a long time. But and then we'll talk about education, particularly higher education in Fort Hays State University and the tech colleges and things like that. So I'm excited for them to all be here. I'm a local program chair along with Claire Guston, and it has been tough to put this one together. We will practice social distancing. They will have their masks on. Fort Hays State has pretty much told us we cannot go into any of their buildings and that we need to steer clear of them, and that's okay. I think they're doing their best to mitigate what's going on right now in their facilities. So, but it should be a good group of people, and I'd love to have any of you that can make it to come say hello to them and show them a warm welcome to Ellis County. That's all for me.
Okay. Just one item I'll pass on. Received an email from Donna, a couple of week ago, whatever. And there was a letter attached to it from Attorney General Derek Schmidt that was regarding the primary election and writing candidates. And the Attorney General's opinion was that a writing candidate needed 5% of the total registered voters. And I was pleased to read that because the Ellis County Board of Canvassers were in compliance with that opinion.
Yeah.
So just wanted to pass that on. And we have an executive session.
Yes, sir. I have it right here.
Okay.
I move that the Board of County Commissioners recess to executive session under the following exemptions to the Kansas Open Meetings Act pursuant to non-elected personnel matter exemption. The subject to be discussed during executive session is performance evaluation. Those persons to attend in addition to the Board of County Commissioners are Mr. Bill Jeter, and we'll be back in 20 minutes, gentlemen.
Okay.
I second that.
We have a motion and a second. All in favor say aye.
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 Motion passes 3-0. And the meeting will adjourn at 6:49.
Alrighty.
I think we got papers to sign.
take all of these, right? And you're gonna
give me
those.
Dustin, what time is that